This virus is probably the most infectious of them all. It is linked to a feared complication. How can you make sure your child is safe? This virus is mostly known for its outbreaks, popping randomly all over the world. It is estimated that at its peak impact it caused millions of deaths of young children each year. Its presence is so alarming that every case is immediately reported to the Centers for Disease Control. The disease course involves several stages. After being exposed to the virus, its incubation period inside of you starts. Symptoms usually start with fever, cough, runny nose and red eyes. Small white spots may appear inside the mouth, followed by a characteristic rash that starts on the face and spreads. If left untreated, it can progress into pneumonia and, in most severe cases, into a progressive neurological disorder of children and young adults called subacute sclerosing panencephalitis. Diagnosis of this virus is usually based on clinical appearance and history of potential exposure. Its presence is confirmed with a blood test or throat swabs that detect its presence or antibodies against the virus. This virus is, you guessed it, the measles virus. It is spread most commonly through the coughs and sneezes of infected people. However, it can also spread through direct contact with bodily fluids. There is no specific treatment against measles. The medications are aimed at treating superinfections, maintaining proper hydration and pain relief. How to prevent contracting the virus? Prevention primarily involves vaccination. The MMR vaccine is highly effective and typically administered in 2 doses. Luckily, the immunity against measles is lifelong. Prognosis has improved dramatically after the implementation of vaccines. With 99% immunity against the virus, measles is rarely fatal these days.